Good morning, everyone. Myself Shwetha. I'm basically acupuncturist. I'm practicing acupuncture, acupressure, Sujok, and magnetotherapy, marma therapy, crystal therapy, and also a lot of alternative therapies. So, anything about the health, you can ask the questions. Everyone know the Sujok therapy? Otherwise, I will introduce from basically.
Yes, please.
Okay, I will start with basic. Okay, in the Sujok, what is the major? That is the whole body. What is the
Can
concept
you
of
be
the
a little
Sujok?
more louder, please? Your
Okay,
voice is very low.
okay. The Sujok is the system where whole body organs is represented in our hand. Okay, this is the simple technique and very very effective. Instantly, we give the result without knowing any medical knowledge. It can be practiced by anyone. Okay, that is the simplest way of treatment. So in this Sujok, Su means hand, Jok means leg. Okay, in our body, what are the organs are there? We can represent with our hand. So I will take in the left hand. Okay, like this. In this tip of the thumb. Okay, tip of the thumb to up to this area. We represent our whole, that is neck to head to neck. What are the body parts are come in this area? It will be represented in this area. Okay, in our eyes, nose, teeth, mouth, and throat region. And come to the part of hands and legs. These are the two fingers. That is the index finger and little finger. Both fingers represent as a hands. And these two fingers, which is longer fingers in our hand, it will represent our legs. Okay, are you clear? Once again, I will, is it necessary to
Yes.
explain? Okay. So just you hold this like this as I hold. So it will be clarity for you. Okay. The small fingers in our hand, these are the small fingers. This is a represent our hands. That means in the thumb area, this is index finger. This index finger represent left hand. And in the right side, that is little finger, this represent the right hand. Okay, and this is the our legs. Okay, if the, okay, I will give the example so that you can easily understand. If the person having the shoulder pain, okay, if I am having the shoulder pain, so I have the shoulder pain the left side, so I will choose the, which finger I am going to choose?
Index finger.
Yes, very good. So this is the index finger. We have the pain in the left hand. So we have to choose the index finger. So God is manufacture our body is very, very specially. So in the Sujok, we use it that technique. Okay. If the person having the shoulder pain, so we can see this one finger, isn't it? So here three lines are. That means three joints. Okay. This is the three joints. Like that. If the, we have to put just for knowing the things, so I will show like this. Okay, this is the first joint, that is our shoulder joint. If the person having any pain in the shoulder joints, we have to go index finger and this joint. How to give a pressure? You can give the pressure with your hands. Otherwise, everyone have this acupressure ring. You can use this ring. Yeah. Okay, like this. Okay, you can just give a pressure in here. So whole ring, yes, whole finger you have to give a pressure like this. Use ring like and just give a pressure. Okay, so in this thing, what happened? Our shoulder pain will be gone within 2 minutes. But you have to try once, then only you can get the result. Okay. After that, the person having a elbow pain. Okay. In that case, what you are going to do, you use a ring or pressure. You have to choose this joint. Okay. मिडिल, जो मिडिल लाइन आपको दिख रहा है ना, उसके ऊपर आपको क्या करना है, प्रेशर देना है. Like this, you can give a pressure. Okay. If the pain is from past 2 years, sorry, past 2 minutes, 2 days, it will be gone. Otherwise, it may be 2 years. It will take time. 2 to 3 sittings it will take. Otherwise, it will go on within 2 minutes. If you having today pain, it will go within 2 minutes. Okay.
How
This is
much
the
time you
minimum.
should do this?
Sir,
How much time you should do this?
till the pain has gone.
Or till the pain?
And when you giving the pressure, it should be tolerable for the patient. Okay. That is very important.
Okay.
I
The
think
shoulder,
after food or something, you can't do it. No? There are some rules and
yes, yes,
regulations for this.
yes, that is the regulation is there. But in the case we are doing for the shoulder pain, no, we restrict because the digestion will be obstructed. So here we are doing for just a pain related problem. If the person having severe pain, then you can use. Otherwise, you have to give the gap for the period of 2 hours. If any emergency, you can do. Okay. Otherwise, you have to give a gap for the 2 hours. So you can easily get in the, if the shoulder pain, you have to go this area, first joint. Okay. And if you have the elbow pain, then you have to give a pressure on the middle one. Okay. Did you understand?
Yes, yes, clear.
Okay. Next, if the person having the wrist pain, okay, in that case, there is a third joint. So in that case, you have to put a ring in the third joint and you have to give a, first you have to start with the gentle pressure. After that, you have to start more pressure, give more pressure till the person pain will gone. So like that. Okay. 2 to 3 minutes minimum, you have to give a pressure. It gives wonderful result. Okay. Like that, if the person having the right side shoulder pain, okay, then he has to give the here. He has to put the ring at the little finger. So he has to give a pressure in this area. Okay. Like this. Then the person having the right side elbow pain, then you have to move in the middle one. Okay. Then you have to give a pressure in the this area. Okay. And then if the person having the right wrist pain, then you have to move in this area. That is the third line. Okay. Like this. Now, is it clear for everyone? For the shoulder joint pain and elbow joint pain and wrist pain. Is it clear?
Yes, clear. Yeah, it's clear.
Okay. Then generally the person's having the pain in the neck region who was watching and working with the laptop or any other reasons. In that case, I already first I will told that here that is the neck region is the thumb end. Okay. So if the person having the neck pain, then you have to put in the ring in the thumb side. So you have to give a pressure on this area. Okay. Like this. Okay. You can get the very, very fast result in this method. And for neck pain, one more point, generally I will introduce every session. So this is the acupressure painkiller point. Okay. When you see in your hand, this is the point. You should remember this point. It will give also very instant result. It acts as a painkiller point. Okay.
Headaches also?
Yes, any type of pain. If you have, you can use.
Throughout the body, any type of pain?
Yes, yes, you can use. This point is very powerful. We call it as a painkiller
How to
point.
identify the point? Can you
Just
just
see
tell me?
here. Okay. You can see here
Is it bottom of
the joint.
thumb?
In our thumb and index finger joint, you can see here.
Oh,
Okay, this is the tip
okay.
where the
Oh,
here.
okay, okay.
You mean V shape, that bottom one, V shape
Tip
starting.
of the that just I will mark it up and I will show. See here the tip of the line. You can see when we fold. Just see this line is well ended.
Yeah.
In that point, you can generally now you can detect this point. You can press now. You got the pain, and it is not only a painkiller point. It will in the problem of gastritis, in the irritable bowel syndrome, or any throat issues, any lungs issues, or any large intestine issues, और कभी कभी थ्रोट में प्रॉब्लम आ जाता है ना, गला बैठ जाता है, उस वक्त भी आप इस पॉइंट को एक्टिवेट कर सकते हैं. और जहाँ भी हमारे बॉडी में यानी कि स्टिफनेस इन अवर जॉइंट्स एनीवेयर, so if you give a pressure on this area in the both hands, instantly you can get the result. If the stiffness is there, so how to give a pressure? In that case, we are not giving a pressure like this. Generally, in the acupressure, we give pressure gently. Just if you give a pressure like this, just give a pressure and you have to take deep breathing. Okay. When you are pressure, you can take a deep breathing. And when you stop giving pressure, then you have to breathe out. Okay. This is the normal procedure for pressuring the each point. But in the case where the stiffness of the body or stiffness of the neck, in that case, you are giving a random pressure on this point. Okay. Like this. You have to give a random pressure point. In the case of pregnant, we should not touch this point. Okay. There is a contraindication of this point. We should not touch this point for the pregnant woman. Okay. Like this. If you give the random pressure in this area, immediately you can feel the stiffness of the leg will be removed. Yes, ma'am? Any doubt?
कंफर्म नहीं करेंगे, कुछ न कुछ नया बात नहीं. आपका तो थिंकिंग ये सब मेरे साथ तो मत करिए साहब. I get very disturbed for this.
So she's not talking to us.
Okay. Okay. This did you get the point?
Yeah.
Everyone, just try on your hand. So this is a very, very important point. If the person is suffering from gastritis, gastric problem, indigestion, any that is a bowel movement problem, irritable bowel syndrome, constipation, yeah, loose motion, whatever it may be, it related to lungs and large intestine and digestion issue. You can use this point, and also any type of pain. Instantly you get the result.
How long to press, ma'am?
Generally, we have to give a pressure for like I show the pressure. No, this type pressure for the 14 times we have to give. This is the basic technique of the giving the acupressure. But if you want, in the case of stiffness, you have to give a random for 2 to 3 minutes.
Daily
Like
only
if
once or it can be repeated daily.
we can repeat it. If the problem is severe, so you can use for the 3 times a day. Like we are taking a tablet 3 times a day. Like that, we have to give a pressure 3 times a day. According to problem of the severity of the problem, so you can choose the times. Okay. This is the one painkiller. If it is the shoulder pain and elbow pain and wrist pain. Is it clear for everyone?
Yes, yes.
Why only left hand? Any reason? It's not right hand fingers doesn't represent.
This is actually the Sujok is a technique So I want to introduce that it is a special technique in the Park Jo. He is the person who invited the Sujok. Okay, in whole this farm area, he invite 25 types of therapies. Okay, different therapies. Those are, one is the acupressure where I'm giving now how to give a pressure. One more is the seed therapy, magnetic therapy, chakra magnets, like that. 25 varieties are there. Twist therapy, lot of therapies are there. Try origin, like that. But I'm showing it basic therapy. If you are not giving a pressure, so then you have to give a seed therapy. How to give a seed therapy? Everyone know this. Meditate in your kit. Okay. Otherwise, you can get it in the medical shop. So taking this meditate, and you have to put the methi, whatever we use in our kitchen. So take like
Moong, hara moong.
No.
Akka moong or methi seeds, no?
methi seeds, fenugreek seeds. Fenugreek seeds. See here. This is the methi, that is fenugreek seeds. Okay, like this, you have to put the methis on this meditate. You have to first, before putting the methi strips, you have to give a pressure, which joints you have the pain. If the pain in the front area, like here, if you have the pain in the front area, you have to give a pressure in this area. Okay, just giving a pressure in this area. Okay, and then if the person having the shoulder pain in the back side, so you have to give a pressure in the back side. Okay, like here. Okay, then you have to remove it, and then you have to put a methi on this tape, and just, if the person having the front part shoulder pain, then I am putting here. Okay, just put like this. Okay, after putting the methi, you have to give a pressure. But one thing you have to remember, whenever you doing the Sujok therapy, you have to find out the painful part. Generally, what happens in the pain area, in the shoulder area, some person having the pain in this area, some person having the pain in this area, person having pain in this area. So we have to detect the point here properly. So how can you detect here? After putting the methi, you have to give a pressure. I think everyone has the probe now.
Yes.
Okay. So I will show the. So like that, you have to put. It, so you can use every day till the pain is gone. Okay. Anything doubt?
We can use both acupressure ring as well as this methi seeds.
Yes. If the problem is severe, then you have to use methi strip also. If the problem is acute, that means you have the problem from 2 hours or 2 days. It will be gone with the ring itself.
Okay.
Otherwise, you have the problem in the 2 years. Then you need both. You have to give a ring pressure and also methi strip pressure. Okay.
So this methi seeds, how to use it for gastric? In case long term, that pain point what you mentioned, right? That.
Yes. What happened? If I am telling the concept, it is not problem. Okay, you can put here. Okay, this area in left hand.
Okay.
This is the liver part. Okay, this is the liver part.
Okay.
In this area, you can put the methi strip.
Oh, okay.
So before putting the methi strip, you have to give a pressure properly, and take a probe. You have to find out the each point. Okay, where is the painful point? In Sujok, this is the main principle. If you find out the painful point, that means 90% problem will be solved. This is the technique of Sujok and miracles result. It may be the severity, whatever it may be the severity. If the person having liver cirrhosis, maybe that will be cured by because of find out the painful point. So that is very important. Okay, whenever using the Sujok, you must find out the painful point. Then you can put the methi on that in this liver. If you get the painful area is this much, you can put the methi this area only. Okay, like that. Otherwise, if you doesn't know how to get the painful point, you can cover this much. So methi strip.
For liver, is it? Is this the liver?
Yes, this is the liver.
Okay. Is the shape also of the liver?
Yes. So whatever, it is a little bit confusing, but everyone doesn't know about the Sujok, no? That is, I am telling the basic, okay? If the laptop is there, I will show a lot of pictures, everything.
Maybe next session we can try.
Okay, definitely.
Thank you.
Thank you, madam. Thank you.
Thank you, everyone.
Thank you so much. Next time we'll do the knee joints and all. Knee joints.
Okay.
Now we did today hand. We'll do